Welcome to the National Hispanic Cannabis Council's Educational Committee Forum on Cannabis 101, where we bring medical professionals together to demystify the health and wellness power of cannabis and to help break down the Latino community's long-held cultural taboos and beliefs on the plant. My name is David Sanchez, board member of the National Hispanic Cannabis Council, and today we bring together two cannabis doctors and my partners from the NHCC's board of directors, Dr. Phil Burns and Dr. Craig Ontell from New York State of Mind, to discuss cannabis and diabetes. As I said, my name is David Sanchez, and a little bit about myself. I went to the University of Colorado Boulder, where I studied chemistry and biochemistry. Since 2012, I have been taken a huge interest in cannabis and have dedicated my career to learning as much about this miracle plant as humanly possible. I specialize in the manufacturing processes, and over the course of my time in the industry have designed and commissioned multiple manufacturing facilities and have launched dozens of cannabis products nationwide. I'm really happy to be here with you guys today, but even happier to know our two special guests. Dr. Phil, Dr. Craig, thank you guys for joining us today.
Thank you for having us.
Yeah, and without further ado, I'll introduce my guest, Dr. Craig Ontell. He trained at NYU's Rusk Institute of Rehabilitation, and since then he has spent nearly 15 years of private practice in NYC. Craig also served as a director of ambulatory orthopedic rehabilitation at NYU Langone's hospital system. In May of 2021, he left NYU to become CEO for State of Mind Cannabis. It was an interesting year to do that with COVID going on. But since then, he has personally treated hundreds of medical cannabis patients over the past few years and has had significant success in weaning patients off of narcotic-based medicines and substituting with non-euphoric, non-sedating cannabis-based options. Dr. Ontell has been published in numerous cannabis articles and has presented at national conferences. Welcome.
Thank you.
And for my second guest, Dr. Phil Burns is a DO and has been practicing medicine for over 20 years, completing specialty training in the field of physical medicine and rehabilitation at NYU Langone's Rusk Institute of Rehabilitation Medicine. Upon completing the training, he founded and has operated a successful medical practice specializing in orthopedic rehabilitation as well as prosthetics. Dr. Burns is driven by his desire to make a meaningful impact in the state opioids crisis. Dr. Burns, welcome to the show.
Thank you for having me.
Yeah, and you know, one thing I don't think we've ever talked about, how did you guys meet?
We met.
How did you guys cross paths? Obviously in New York, but how so?
We met in medical school.
Week one of medical school.
First day, first class, you guys sat next to each other and became best friends?
Pretty much.
We were close to it. So we've been working together now for probably close to 3 decades when all is said and done. So we went through medical school, residency, and practice together. So we've been at this for a while. Some folks say we share a brain.
Yeah, I know how that goes. Well, thank you guys for sharing that. For today's NHCC's Educational Committee Roundtable on Cannabis 101, our intent for this session is to provide an informative overview of cannabis and diabetes. And so before we begin, I did want to say a few words about the National Hispanic Cannabis Council's mission, which is to educate the U.S. Hispanic community on the health, wellness, and economic aspects of cannabis and to empower their support and participation in the industry. Also to help demystify through educational programs such as this, the health and wellness power of cannabis and to break those long-held cultural taboos and beliefs on cannabis. Guys, let's begin the show. And how do we start? Where do we start? This is always a good jumping point, but
I'll hop in on this one to start. So this was a much bigger lift than Phil and I originally thought. It's diabetes and cannabis really is not at the forefront of what folks come in to see the physician for. When Dr. Burns and I see patients coming in for cannabis, it's usually due to anxiety, pain, depression, sleep. So the diabetic patient coming in is far and in between. So this was eye-opening to us, and we learned a lot. So we want to thank the NHCC for asking us to do this talk, because we're only going to be able to help patients better. First off, right off the top, which was shocking to me, is roughly 1 out of 4 healthcare dollars in the US is spent on diabetes management.
Wow.
Yeah, wow. So we're talking roughly, north of $300 billion a year on managing diabetes. And the Hispanic population tends to have a higher incident or percentage of diabetes, both symptomatic and asymptomatic, than the general population. And that further even gets broken down in subsets of Hispanic folks based upon where they come from geographically. So race plays a big factor in this, as does ethnicity. So when we talk about diabetes, I really was trying to get a unifying theme or one word that I could attach everything to. And that word is inflammation. And that's going to tie right back into cannabis and THCV, which we're going to talk about, and CBD, and some terpenes like beta-caryophyllene. And it's really the inflammation that gives us a lot of the symptomatology and the secondary effects or the secondary problems due to diabetes. So we're going to focus on inflammation today as well.
Perfect. And I think you said a couple of technical terms there for our audience. We heard cannabinoids, terpenes. Before we dive into all of that, what is a good working definition for diabetes, and how is it really caused?
So I'll jump on that. Diabetes is a group of diseases that primarily manifest themselves as your body's inability to really utilize glucose, whether it's too high, or it's really related to the pancreas and your inability to take glucose from the blood and break it down, right? So you have type 1 diabetes, which is a chronic condition, and usually affects a younger population, and it's a disease of lack of production of insulin. And type 2 diabetes, which is usually in an older population, and it's a resistance to the insulin that's being produced. There's also gestational diabetes, which is occurs in pregnancy, and obviously that is not a permanent condition; it's reversible. And prediabetes, which is really a precursor to the chronic conditions, and it's where you're inefficient in the use of insulin, but you're not really hitting the mark to make it diagnosis for chronic the condition of type 2 diabetes.
Awesome. Thank you for that. Well, let me ask you a question, Dr. Burns. How do you keep type 1 and type 2 straight in your head? I feel like I always have issues with which is that 1 or is that 2? Is there an easy way to remember that, or how do you keep it straight?
How do I keep it straight? You just know it. It's memory.
It used to be easy. It used to be easier, as we've been at this for a while. So when you go back in time, a type 1 diabetic was pretty much thrown into someone who is insulin dependent, is going to require insulin. And your type 2 diabetic didn't require insulin. They required another class of medication to help manage their diabetes. But those lines over time have become a little blurred, and there's some crossover now. So it's a little more difficult. But at a high level, how I look at the difference between type 1 and type 2 is your type 2 diabetics, much like Dr. Burns mentioned, you kind of see them a little bit later on in life, and it's very frequently secondary to obesity, poor diet, socioeconomic. a lot of the less or not so much genetic factors play into that.
Got it. Awesome. And what are some common treatments for someone with diabetes today?
Well, for the insulin dependent, obviously it's insulin, right? So for the non-insulin dependent, there's a series of medications, oral, which can be taken that either help your body be more, help with insulin usage, or decrease the breakdown of carbohydrates into the simple sugars, and that occurs more in the digestive tract and the liver.
Okay. And so my father-in-law, he consistently is, when we go eat with him, he's checking his blood sugar, and then he's like, oh, I got to go get a shot. So you're saying he's more type 1?
Yes.
Yes.
Okay, awesome. That's good to know. All right. And what do you think are some of the major misconceptions around prescribing some of these measures for someone with diabetes?
From a cannabis perspective, it's really a lack of education, and a lack of education is unfair to say. It's more of a lack of research and a lack of concrete knowledge as to really how cannabis and cannabinoids and other breakdown products of the plant affect glucose metabolism and overall body metabolism. Just to put it out there, and as a mic drop moment, cannabis is not making anyone's diabetes worse. Cannabis is not interacting with the diabetes medication that you're taking right now. So we scoured a ton of research here, Dr. Burns and myself, going back literally to around 2008. We didn't want to go much before that because the data's getting too old, all the way up through pretty much 2020, 2021 as well. And we weren't able to find anything that really had a cause and effect between cannabis use and worsening diabetes, or really interacting with any of the medications that they're taking. When we're talking about cannabis and we're talking about diabetes, we're talking about a few specific things here. First is we're talking about THCV, which is a subset of THC, which most folks who are watching this have heard of. And THCV has been shown to have a direct effect on overall glucose levels and utilization. And then we're looking at CBD specifically. CBD targets something called the G protein complex, which in the body, in simplistic terms, is very important for insulin and glucose regulation. The pharmaceutical products that you were asking about a moment ago also target that same G complex. So we're looking at THCV and we're looking at CBD. We're also looking at what are these things actually doing and how are they helping? And I mentioned the word inflammation before, but I'm going to go right back to it again now. CBD, THCV, I mentioned beta-carophylline before, which is a terpene. Those all affect inflammation. The inflammation is what ends up causing the end problems, or helps to cause the problems with diabetes. You end up with heart disease, you end up with chronic inflammatory problems, you end up with a diabetic retinopathy in the eye. So these products help along the way. Finding specific strains or cultivars, whatever the terminology we want to throw at it now, that is high in THCV and high in beta-carophylline, that takes work. And there's not a lot of them out there. I'll use one, for example, something called Durban. That tends to have a high percentage of those products in it.
Yeah, Durban sour diesel is also known to have high percentage of THCV, which those strains are becoming more popular for a myriad of reasons. But interesting to see how THCV and CBD are helping the cause here for diabetes. And so, do you recommend cannabis or your patients who have diabetes? Do you recommend cannabis for them?
Dr. Burns and myself sit in the orthopedic and pain world. So we don't sit in the endocrine world. So we don't have folks that are coming to us purely for diabetes management, but they're coming to us secondary to the side effects of diabetes. And the number one side effect that we see, or one of the most prevalent, is a diabetic neuropathy. And Dr. Burns and myself see that all too frequently. And those folks are effectively managed with cannabis-based products.
Interesting. And so personal story, father-in-law has diabetes. He's currently on dialysis, and he had major inflammation in one of his feet or his foot, and it's swole up so bad that he essentially has a really hard time walking now, and it's gotten to the point where the bottom of his foot has really become affected. And so I think for a long time, he's been curious, like, is cannabis something that can help? He also just wants to, help getting to sleep because he's on dialysis. He feels like his mind races, or maybe he just can't settle down to go to sleep. And so would somebody like that benefit from cannabis?
Absolutely. He's, someone like him would benefit from cannabis. The provider needs to be a little more careful when they're, dealing with a patient like your father-in-law, because once your diabetes gets to that end stage renal disease, which is one of the sequelae of this, you tend to get multiple organ involvement. It's not just the liver there. I'm sorry, it's the liver, it's the kidneys, it's multiple systems. And a lot of the medications that subset of patients takes gets metabolized through the liver. So we need to be careful with that. So somebody like him would benefit, especially if it's an isolated foot issue, from something more like a topical, because the topical will bypass that liver metabolism.
Yeah, I see. So you don't want to keep the liver because he's already on dialysis.
It's his liver is involved. It's his kidneys that unfortunately, fail from, which is why he's on dialysis. But the liver gets involved as well. And usually, when you're on dialysis, you unfortunately have some other concurrent medical problems. So you're on a multitude of medications that get metabolized through the liver. So if we could avoid taxing that liver anymore, we would.
Gotcha. Okay, and then so how can patients know if cannabis is a candidate for treating their diabetes, or what would be some things that somebody listening to today's podcast can say, oh, I might be eligible, or this is something that I've been thinking about?
Treating diabetes with cannabis, we're not there. So, we treat diabetes with our proven medication regimen for a type 1 insulin, or type 2, which is usually more of a pill format. Mm-hmm. So it's not so much treating the diabetes, it's what's the cannabis going to do to help with the effects of the diabetes? And hey, maybe cannabis might prevent diabetes. And I loved stumbling upon this article or two. And, the conception out there is your cannabis user uses cannabis and they get the munchies and they drive the White Castle with Howard and Kumar and they're getting burgers and the whole 9 yards. But when you look at your cannabis guy, or, male or female, or, patient, they tend to be thin.
Yeah.
So what's going on here? Like, these guys are not really heavy. Mm-hmm. So how is it that something where we have this conception that they're going to start eating a ton of food and they're still kind of not heavy. So there's been some research done on this, and the research was done with mice instead of men. And what the researchers did was they took teenage mice, so mice that are in their teens, not little ones and not adult mice at that point. And the reason why they chose that is because that is typically when most cannabis users get exposed to the product first time. Yeah. And what they found is the mice that were fed or given THC had reduced fat mass, increased lean body mass, higher than average body temperature, and were partially resistant to both obesity and hyperglycemia. Wow. Now, the flip side of that was they had a reduced ability to use fuel from their fat stores. So let me back up a second here. We burn fat for fuel. Got it? And when these mice were fed that, their enzymes, their protein metabolism changed a little bit, and they were generating more lean body mass. They were, but they really weren't utilizing that fat in the right way. And where that comes into play, they noticed it with memory and cognition, or memory more so than cognition because it's mice. So that was the trade-off that they found. They found similar results, but not to the degree when they studied adult mice and started them at an older age. So it is, folks tend to be leaner. They tend to be a little more glucose tolerant and resistant to hyperglycemia. So what happens with the patient? Where's the flip to that coin? There's always two sides to a story. I got it. I see you guys looking at me and waiting. Who runs into trouble here? You're diabetic like your father-in-law, the other person you mentioned, who's sitting at dinner and has to monitor their glucose. They have to know what's going on. And if that person is taking too much cannabis product, a little too much hot, a little too much THC, it's, I hate to say it, they forget to check their glucose, and that could be an issue. And also, in your more native user, or someone who's not, using cannabis regularly, if you take it, you might mistake the feelings you get from being hypoglycemic or low in sugar, or hypoglycemic high in sugar. That may be a little confusing with how you're feeling cognitively from the THC.
Yeah.
So those are factors that come into play.
Those are very good points. Yeah, because I know that he did have issues if he didn't poke himself and not really understanding if he was feeling okay or not. And at one point he passed out, and we got to the point where it's like, all right, you really need to be checking your blood sugar. And so I appreciate you giving the two sides of the story there. I mean, it's important for folks to hear that.
Absolutely. And it's in reiterating that, diabetes is something that the effects can be short term, in terms of, if your blood sugar level is too low, you could pass out. If it's too high, you could have other serious health issues that could be emergent. And then some of the long-term sequelae or issues that we see with diabetes, we don't see, patients are not sort of appreciative that those are down the road type issues affecting your eyesight, affecting your kidneys, like you had mentioned, affecting the vessels in your legs, the nerves in your, throughout your body, et cetera. So we need people to really be on top of monitoring. So that's the, finger sticks, or the other methods now that are more advanced to monitor your blood sugar level continuously. And there's different blood tests that your physician will do to see how you're doing over a 3-month span. That's the hemoglobin A1C test. But really staying on top of your diabetes to not only keep you healthy today, but prevent those long-term sequelae. And cannabis can be used to mitigate some of those long-term issues by way of the antioxidant effect and the anti-inflammatory effect that Craig was alluding to. So just to sort of realize that we're looking at two different baskets. There's short-term effects, which can be very serious, but also long-term things that people don't see initially, but will present themselves if their diabetes isn't tightly controlled.
Yeah.
And when we talk about CBD, what we're specifically getting at with that is it increases insulin secretion. We see that. So that's going to help with your diabetic that is behind the eight ball with their insulin secretion. And when we talk about THCV specifically, we see that use of that has a decrease in fasting blood sugar concentration. And what Dr. Burns was just alluding to really is, what are we looking at long-term here? And while most of the evidence out there is still anecdotal, and we've spoken many times about limitations on research on these talks we've given federally here, the anecdotal evidence does show that cannabis products will stabilize blood sugar. They will decrease arterial inflammation, so inflammation in the arteries, which in diabetics will lead to heart disease. They will decrease neuropathy and the pain of such. You end up with a lower blood pressure over time. Blood vessels are more patent and open. We've seen a decrease in GI cramps and GI issues in patients who use cannabis. So I'm keep going back to that inflammation. The benefits are out there. It's really the science catching up to what I said anecdotal before, what patients and consumers are reporting. And it's up to us now in the science and the medicine and the medical community to back up those subjective pools of data that we're getting in with objective findings. There's a lot of work going on right now in the pharmaceutical world. One company in particular, GW Pharma, which folks may have heard of, they're UK based. They're doing a lot of work right now on diabetes and CBD and the specific terpene profiles to try to formulate a product so we have another avenue to address diabetes.
And so what is some of the work that GW is hoping to do? I know they have some work in the THCV space. They obviously already launched Marinol. But what can we hope from GW, and can we expect like a standard remedy from them soon?
That's the hope. You need a lot of patients and you need large studies in order to prove something out. So hopefully they're able to recruit enough patients who are diabetics or even pre-diabetics. And what they would be doing is really on a high level, figuring out the specific formulation, the specific ratio of various components of the plant that we know help with inflammation and we believe help with glucose control, and coming up with a standardized product for that, because there is just so much variability. And if we take a step back and we talk about CBD, which I mentioned a few times, all the studies out there, all the research shows, and I hope folks are sitting down, 70% of the CBD products that someone buys are mislabeled.
Yeah.
So you really don't know what you're getting. And this kind of goes back, and I don't want to alienate anyone on this talk, but very similar to the vitamin industry and the supplements, where we frequently have patients that come in and they got a list of supplements they're taking and they ask us our opinion on it. And I say, I can't help you. And the reason I can't help you is because I don't know who's making these. I don't know what's in it or not in it. And I really, since I know that roughly 70% of the data out there isn't accurate, I can't give you an opinion. And it makes it very difficult for us. This industry will move a lot quicker than that industry just because there's a lot more momentum behind it. and pharma and the pharmaceutical industry and the medical industry is behind it, more so than in the supplements. But it's difficult for us when we have a patient come in with this.
No. And I appreciate that analogy. I think sometimes folks, as part of the taboo, say, oh yeah, you can't trust those products, right? And then, facts like that come out like, hey, 70% of products are mislabeled. But to your comparison, it's not much different in the nutraceutical space either. And, not to say those are bad folks or have bad intentions, but you don't know where those products are getting manufactured. You don't know what certifications and licenses their manufacturing facilities have, and if their active ingredients are up to snuff. So definitely appreciate that. And so, as a following question, what kind of cannabis products should patients be looking for, and where do you find them?
So first off is, Dr. Burns loves this word or term, the entourage effect. So you got to be careful, and you need a product that's going to give you the fullest expression of the plant. So a product that's not, if you get a purely driven down CBD isolate and it's 100% CBD, you're not getting your bang for the buck on that, because you're not getting the entourage effect of the other components of the plant that are all synergistic. So that's very important. You want to find a broad spectrum product and not something that's really kind of been honed down to one specific isolate.
Okay. And in terms of application, I know we talked a little bit about topicals for the inflammation of someone's foot in that instance. Inhalable gummies or capsules.
All of them have their pluses and minuses. So when we talk about an inhalable, you get that entourage effect. You do. You get hit with every single cannabinoid. It's all getting you at once, and you have the entourage effect. Of course, you're taking smoke into your lungs. It's, we've been working on, for 40, 50 years to get rid of smoking in this country. So, good luck pushing that past your pulmonologist friend. But you get the entourage effect, and you will get it fairly instantaneously. Then when we talk about the edibles, that's where we got to worry about the liver and that second pass metabolism. So when you're diabetics that have, God forbid, end-stage renal disease or other organ involvement, we got to proceed there very judiciously. Tinctures in the medical community are great because we could really monitor the dose, it's not that easy with a smokable or inhalable product. I get it, a vape tends to be measured, but still tincture, you're very, very specific. And then there's the topicals, which I mentioned before, which on a isolated joint or a region work well, with the caveat that it's not that easy to transduce what you mentioned, the active ingredient or the medication through the skin. So if the individual is using a topical for something and it's, if I'm using it on my wrist, I get it. There's not a lot of room between my bones and what's going on here in the outside world. But if I was going to use it on my hip, you got to get through all that extra tissue and everything. It's not going to be effective. I'm being nice.
That's right. No, and as you said, gummies versus tinctures, I thought, what about the sugar content in the gummies? Some manufacturers have 5 gram, 7 gram pieces, where some of that formulation, there's a lot of sugar that goes into it. And so
I'm glad you brought that up. So let's talk beverages for a minute here.
Hey.
So Dr. Burns and I are all about the beverages. What I like to say, beverages are the end of The Graduate, where the gentleman is telling Dustin Hoffman to get into plastics. Beverages are the future here. They are cannabis. Beverages are a great way of ingesting the product as medication. We look at beverages all the time. A lot of them are loaded with sugar.
Yes.
So there are low glycemic options out there for beverages. A lot of folks are starting to use monk fruit as a sweetener, which is a very low glycemic option. So beverages absolutely are a way to someone to get their product. And there are low glycemic options out there, but you need to be careful with gummies and beverages with the sugar. You do.
And when you say low glycemic, are you kind of saying like something that's sweetened with aspartame or saccharin, or are you just saying something that just has minimal sugar added, or both, I guess?
Both. It's both. Something called a low glycemic index. So it's not really going to raise your sugar.
Perfect. Yeah, well, that sounds like an opportunity for someone to make a low sugar, low cal drink and low sugar, low cal gummy, huh?
You see Dr. Burns smiling, don't you?
It's got the eye of the tiger over there.
It does have the eye of the tiger. Yeah. It's diabetes, like I said, it's 1 out of 4 healthcare dollars in this country are spent on diabetic management and treatment. So it's prevalent, it's out there, it's in the Hispanic population. They tend to have a higher percentage than the general population running around.
Absolutely. Let me tell you, Latino food is jam-packed with cheese. It's jam-packed with sugar. It's jam-packed with grease. We'd like to fry a lot of food. And definitely, yeah, it's tastes great. Everyone will tell you that, but it's hard. It's hard, and some cultures are simply just like that. And to our conversation today, father-in-law has diabetes. A lot of people that I know in our community have diabetes, and I think this talk was a little overdue, because folks are asking and clamoring for, like, how do I help improve my quality of life, and is cannabis something that I should be thinking about, or I should be consulting my medical professional about? And so
quality of life, yeah. And we get this all the time. And, I love to speak to patients. And that's the first thing they always say. They usually come in and we wean them off. I know we're talking diabetes, but we got them off opioids. We got them off sleeping pills. And the phrase out of their mouth is always the same. Thank you. I have my life back. It's always the same thing. I got my life back. Thank you. So, and, as we sit here, the stereotypes and the misconceptions of cannabis for a lot of folks is it's just to get high. And we've spoken many times that we formulate cannabis products that doesn't get someone high at all, but they get the benefit, whether it's pain, inflammation, sleep, hopefully tighter glucose control. So that's old thinking. It's not really the reality of the science behind this.
Totally, and I completely concur from the manufacturing perspective. We are getting better at isolating these compounds, at consistently creating a high purity product that we're able to intentionally formulate and design to drive specific benefits. Previously, making THCV was very difficult and very expensive. And while it may still be pretty costly, some of those costs are becoming to be driven down due to innovations within the manufacturing space, and folks really being able to scale up some of these very new processes. And so I do think availability will improve. Yes.
And I think that to your point, in strain development and developing, where in the past people were chasing, a high THC for the recreational market at the expense of the other cannabinoids, right? Now what we're seeing is people that are dedicating a more diverse picture, right? So we're having all the different cannabinoids being represented rather than just the THC, and also the terpene profiles, which are going to be sort of the compounds inherent in the plant that are going to be sort of protective of the plant, but also protective of you in terms of the antioxidant and anti-inflammatory effects, So, but, when we talk about diabetes, obviously it's diet and exercise, diet and exercise, diet and exercise. Check your sugars, right? Routinely. Diet is to your point of the low glycemic index foods, those are the foods that aren't going to give you a big spike in blood glucose, right? So you could have things that have sugar and that have the more complex carbohydrates that are going to give you a more sustained release and not give you those big ups and downs and spikes, which will make it easier to control, but also portion control where you're not, ingesting a huge plate of pasta, but you're having a normal size, right? And then obviously, like I said, following with your doctor, monitoring this, staying on top of your blood sugar, adjusting your medicines appropriately, and then seeing if cannabis is right for you, respectful of your overall clinical picture. So other comorbidities or other medical diagnoses you have, other medications you might be on, et cetera. But this should really spur the conversation that you have with your doctor or healthcare provider in determining, is cannabis right for you, working with a reputable medical dispensary that is going to be able to offer you a cannabis product that, again, is respectful of the cannabinoid and terpene profile. That's going to properly address what's going on with you and likely give you the best overall outcome for the short term as well as the long term with the comorbidities we discussed earlier. And obviously the medical dispensary is highly regulated and is tested pretty extensively. So you're not going to get the pesticides, herbicides, organic chemicals from the fertilizers, et cetera. And then all the God knows what that's in the street obtained drugs or.
With the high THC that Dr. Burns just mentioned, we've been watching this race to a high THC for a while here, much to our bewilderment, because it just really, and I know you're laughing at it, it really just reflects a consumer base that just doesn't know what they're looking for. And they caught on to one term THC, and some of the states that it's legal in decided to try to tax based on THC concentration. So folks automatically thought the higher the THC, the better the product. But that's at the absolute detriment to that terpene profile and cannabinoid profile, which is all the goodness. It's kind of like, I think white rice is all washed out and bleached out and there's nothing left nutrition in it for you. So that's your high THC product. So when we look at products now, we look at the label always. And we want to see when they test it, they're showing, 5, 8, 10 at least cannabinoids that are testing positive in this. So we know that's a truer expression of the plant. And that's what folks who are watching this, the take-home message for this is, you heard us say more than once THCV. Got it? So if you're a diabetic and you think cannabis might work for you and you're going to show up at the dispensary and speak to the pharmacist, you want something that's fairly high in THCV. I also mentioned beta-caryophyllene. That's also been shown to help regulate glucose. So there's certain things to look for. And when you look at that label, and it's on every single package you buy, if it says THC, CBD, and there's one other thing in there, move on to the next product. Find something that really gives you an expression of that plant, the entourage effect that I mentioned before, because that's what you're looking for, folks. It is.
Absolutely. And you guys bring up a good point. And I will remind folks watching this, you are entitled and can ask at your dispensary to view and to review the certificate of analysis for the products that you are purchasing. It's not a crazy request. It's not something that you should feel bad about. Any good manufacturer will happily provide this information, and as a patient is a right. And to your guys' point, we want to see detectable levels of multiple cannabinoids within a cannabis product, right? And so I also want to remind folks, cannabis, the plant, has more than 100 cannabinoids, and still more are coming about every day as we continue to research. And so when you see the 4 cannabinoids that are required by law to be put on the package, fully know this is not the full story. This is not the full gambit. That's not everything that's in the kitchen. There's much more to the story. That's just what's required on the package. And so as you ask for these certificates of analysis and you're looking for that THCV, make sure it's on there. If it's not, move on to a different product and see what's best for you.
Absolutely.
All right. Well, today has been a spectacular talk on cannabis and diabetes. Dr. Burns, Dr. Ontel, thank you guys so much for joining us. Any closing words for our audience today?
Always, I usually leave this last minute disclaimer to Dr. Burns, but we're here to give you an introduction. We're here to steer you in the right direction and get you on the right path. But we never tell folks to self-medicate. And if you have diabetes, definitely bounce this off your endocrinologist, who's the one who should be managing this for you. And if we're doctors here, and doctors need to be open, and they need to listen to patients, and they need to not practice medicine with blinders on, because it's an art, not a science. So we know it doesn't hurt. It can only potentially help. So make sure your healthcare provider is open to these conversations and receptive to them. That's my advice for patients out there.
Perfect. Dr. Burns?
I concur. No, this is the goal is with these talks are to educate people so that they can become advocates for their own healthcare, and that they can initiate a conversation with their doctors and ask questions that are engaging, and come to a more inclusive plan to really not only treat their diabetes, but also mitigate or reduce the long-term effects that can present.
Thank you. Well, thank you, Dr. Burns. Thank you, Dr. Ontel, for helping to demystify cannabis and diabetes today. We'll continue to make additional episodes and more Cannabis 101 topics, but thank you for today's conversation. And thank you to all our viewers out there. The NHCC will continue to provide educational programs such as this one.
Thank you for having us. And for everyone watching it, if you go to the NHCC site, or when you do, there's a pretty in-depth medical 101. The NHCC site really gets into a lot of medical conditions. So there's a lot of excellent reading there.
Perfect. Thanks, guys, and have a great day.
Thank you.
Thank you.
Thank you, everyone.
Thanks.